I saw a video about how old is too old to be in pediatrics, but I'm gonna kind of do my take on the thoughts. My own version of why people in their 20s and 30s should be in an adult clinic rather than a pediatrician. I know this might be a little controversial for some people, and it might make some people uncomfortable, but I'm being brutally honest. It's time for some to start growing out for a change. So it might be a hard pill to swallow, but you know what? It's time, honey. Time to move on. There are a lot of reasons why people in their 20s and 30s should start considering if they haven't done so already. Number one, I wrote adequate care because providers in internal medicine and family practice can adequately care for people in their 20s and their 30s. Because I'm going to get on to that part in a second. Because adult providers can care for people starting in their 20s or in their 30s. And you can see them for many years uh, through adulthood. People in their 20s and most, yeah, starting in their 20s now, and most of the people don't hear this from their pediatrician. I'm going to say this once and for all, that the cutoff should be age 21 for pediatricians. The pediatrician should say, no, we're getting too old. You need to start moving on. It's called aging out. I was lucky to still keep myself 25, but when my mom quit nursing, she pulled the plug because I was getting too old, and I was doing some things that I wasn't supposed to do, which landed me there in the first place. Okay. Number 3. Not all family practice or internal medicine doctors treat people rough. There are some good doctors out there, and there are some not so very good. Number 4. This is a huge one for a lot of people. They need to hear this one. Your insurance company, if this doctor is a network, they will pay for that doctor. Period. Number 5. Family doctors and internal medicine providers are age appropriate. That means they start treating people as soon as they turn 18. And most times beyond that limit. But there's some people that transition even earlier. They go into their teens saying they're getting too old for pediatrician. That's okay too. So, and they also can treat the teens as well. Number 7. Most will transfer past medication under the name. If you're going for a pediatrician and let's say you're on medication, the adult provider can take over the medication as necessary. That means you transfer your history, you transfer your medications. So if you need a refill for the future, you could get your future person to refill for you. As long as you see them in clinic. As you get older, your care will change drastically, and seeing an adult doctor will be more effective. This is the truth, guys. It'll be more effective because they diagnose adults. Pretty much. Family practice and internalists. They will diagnose the adults, quickly. And sometimes you have more needs and sometimes you may have less. So it's time that you do this accordingly. If people in their 20s or 30s and they're pregnant while in pediatric care, they may be told to start getting into adult care. since they would be more capable for caring for people at this stage. That is the truth because there are some pediatricians that seen teens get pregnant and they got to do it. Unfortunately, because they got to learn how to grow up. And getting appropriate care will be affecting the human and the unborn. Let's put it that way. And people get medications in 3 months, and they're in their 20s and their 30s. That landed me in adult care right there. Because I was supposed to be on blood pressure medicine. That landed me in adult care right there, and I was well over of my 20s. And my mom just quit nursing because of her health. And what happened was when she found out, it was like Christmas time, I think 2016 or so. And what happened was she flipped out on me. Because knowing if I skipped a certain amount of time on the blood pressure medicine, I could have been very well fatal. I could have had a heart attack and stroke. Where I could have just been, I can't move, can't talk, can't do anything, or even worse off, dead. But luckily I'm not either one of those two. I'm lucky. But my mom had to make the correct decision and pull the plug on the pediatricians. Yes, you can. If you're in that situation and you skip your medicine for 3 months, no, you cannot. Call medicines past 90 days. That is a rule since day one. I mean, it's time to pull the plug and get out of that pediatrician's office and get you in adult care. Yes, that's a major one. You need to do that if you're in a situation. It's time to grow up. If you're 20 and 30-something-year-olds are experiencing adult problems such as hypertension and heart issues, and they're still in pediatrician care, move them on. They're not adequate to care for these kind of patients, and pediatricians are getting frustrated. It's time to transition to adult care. You should have already done that a long time ago when issues arise and they started. Because you might be able to get the referral that you need if you go to adult care. If you have a disability as a child, this could be autism. This is number one. And let's say it's still present in the adult phase, because autism is present even amongst adults. Time to transfer them. Time to make that change, and parents need to quit coddling. Parents need to let these kids grow up. I'm saying it brutally, and that's what it's going to be. Time to move them on and get them to an adult doctor. Pediatricians are not equipped with handling young adults past the age of 21 years of age. Means they only see children. Children only to adolescents to probably about 21. Time to move them on. What can you do if you're in your 20s and your 30s and have not transitioned to adult care? This is a huge one. A lot of people need to hear this. And I wrote down some tips to help. Number 1. Ask your family and friends which care provider they're seeing and which ones they recommend. That is the number 1 I go with. I kind of started with my family's physician when I started seeing adult care. But since I kind of fired his butt, my mom said I could go with my own doctor, which I did. And I went with somebody who's good and who is patient and kind and patients deserve that. And that's what I went with. And for the second time, I swapped. Check to see if that person is in network with your medical insurance. If you got Medicare, if you got Medicaid, which is Aetna, Blue Cross, check with them. They got online portals you can do. If you have not created an online portal, this is your own fault. You should have done that because it's called managing your care. That means you can do that through the click of online and switch that provider within a heartbeat. Okay. Number 3. I wrote this one. This is a really hot topic I should approach. Always have more than one recommendation in case one doesn't work. Okay. I'm going to say this in a general term because not all doctors are in network for all insurance carriers. There are going to be some doctors that are going to not be in your network. They're going to be out of network and stuff like that. You've got to make sure that, okay, because once you type their name in on your portal, if you got one, you should be able to see if they're in network or not. And you should be able to change it. If you do not, go to the next person until you find one. That is. Even means checking with the provider, your carrier, and calling the offices, which I had to do at my second swap over. My mom did the first one, I did the second one. And because the first one to me was an emergency, I was out of my meds for about 3 months, and I had to get into the emergency situation with Medicaid, and she had to call, schedule an appointment, etc. You know, but there's a wait period on all of this, and I think the first time I experienced the switch over was about 30 days to get an appointment on with and get the insurance card. But if you go online, I went online to my second switch over. I went online through United, which Louisiana is just about to expire on March 31st, and April 1st is the change over. So what happened really was, I go online, go to check over to see who can take me, and they give you a list. That's what you do. So okay, and after I jump to my next point. So as soon as you get one in network, you can change your provider by calling the number on the back of the card, or to do that business online. Okay, let me explain this in a way it makes sense. If you have your insurance card, pull it out of your dang wallet. Flip it on the back side. They have probably a telephone line you could get onto. If you don't have an account set with the carrier, you can get onto that. And go ahead and call the 1-800 number that is printed on there, and just follow what they say. Or if you have the online portal, like I said, you can get on their portal, change the care, and usually when you do change it, it appears within 24 hours. But the change, if let's say you change in the middle of the month, it doesn't take place until like the first of the following month that you're supposed to see that person. Okay, so that makes clear sense. Alright, so number 5, start their management early, whether it's meds or medical history. This is crucial because you're going to come across this problem a lot. Whether you go to the ER and they ask about your meds, or whether you go to the urgent care and they ask about the med part, or, and this gets to be important, if you go to a new provider, have that information ready. And let me tell you, it's okay to have somebody in the room on the appointments if you are disabled. They will accommodate it on the adult side. I've been to adult clinics for a while now, 2 of them to be exact. Been to 2 doctors. And my mom has been with me ever since. And they cannot say anything because it's called Americans with Disabilities Act. If you have a disability and you need a support person, they can't say nothing against it. Because if they did, it'll be in violation right there. Okay, the last part is going to get some people on their toes. You have a right to transfer your medical files. And my mom followed this right very well to the code, which got me to the care I needed. You have a dang right to transfer your files under HIPAA. That's right, you can request your files and get sent somewhere else. I hope this kind of gets more in the beef on what to do, and I'll see you later.